What's up, everybody? How are you? With it's Real Talk Chronicles, excuse me, with Malika and Bill. And this is I'm very excited about this segment because we have a family member. We're gonna call her a family member in the house with us. And uh, you just don't always have to be blood, but when people love you and you love them back, you call them family. So with that being said and saying all of that, first, let me just ask my wife, how are you doing today?
I'm wonderful. It's nice to be sitting next to you here again. It's been a while.
That's true.
I know, right?
Well, it ain't. If I don't have any little humor with it, then it ain't really right.
I love it. I love it. I was actually thinking, Bill, it's been about 4 years, almost to the day, since the pandemic that we started doing Real Talk Chronicles.
Right.
Online. On Facebook and YouTube. So
yeah, that's a beautiful thing.
It's kind of like our 4-year anniversary here.
Okay. So, there you go.
Yeah.
So everybody, if you don't know, if you're watching by YouTube or watching by Facebook, subscribe to it by YouTube, please. And we have sponsors at the bottom of the screen, of course, Chocolate, Daily Arts and Survival Magazine, as well as Quality Speakers, Art Gallery, and of course, Row House, which I'm a co-owner of now, and I'm very happy to be a part of that. We have a very dynamic guest. We've done some changes with Real Talk, and we try to be as informative as we can with you all to give you the best knowledge and information out there in the world today. Different than a lot of other podcasts, we want to give you something that you can take with you and you can share. We have a young lady today that she is a doctor. It's so funny. Agnes, I put a post up on Facebook today, on Instagram, and my neighbor is one of your patients.
Oh my goodness.
Yeah, Agnes. Yeah, so it was so funny. My longtime childhood friend, she was like, "That's my doctor." We thought that was so funny and so nice that happened that way. And I think she might be chiming in later. If not, she'll definitely watch it on YouTube. Yeah. But for those that don't know, we have Dr. Theresa Mack. And Doc, first and foremost, how are you doing today?
I'm good. I'm good. Little bit of jet lag now, but okay.
Good. You were on vacation. Tell us about that.
I went to Accra, Ghana. It was for a medical mission, and I actually visited 2 clinics. And this organization takes over a health center in one of the villages, and doctors come. And I was doing primary care. My youngest daughter went. She was graduating from medical school this year. She was doing pediatrics, and it's a wonderful experience. They're really appreciative. I talked to them about diabetes and hypertension, and it was an engaging audience. It looked like they were like hanging on my every word. And it was in the hot sun. And it took a 20-minute talk. It took me 60 minutes because of the translator. And so I was sweating, but it was very good. And they were so appreciative. And when I finished, they have these certificates that they give out, and everything is like a big production to show that their appreciation. So I enjoyed it. And then the other facility I went to, a colleague of mine had passed, Dr. Dominique Bio, and his mother and his family are doing a memorial clinic. And so I went there to see that, to give some advice on how to kind of set it up. so that it will be up and operational within a year. After those 3 days, I just enjoyed Accra, and went around to some of the tourist sites and
Did you get
enjoyed myself.
did you get to hook up with our cousin out there, Adrian?
No, you know what? The Wi-Fi was always going down, but she did respond back to me, but I didn't see it. She said, "How long are you going?" Oh, she said, "I'm so sorry. I'm just now seeing this." And then she said, "How long are you going to be in Accra?" And I didn't see it until I was almost ready to go. So I just said we would see each other the next time. But when her mother was on that last time, I mean, and mentioned it, I was like, "Oh, okay, let me see if I can hook up with her."
Yeah. And it's so funny. I want you to before we start, it's so funny that Theresa and her husband, hopefully he'll join us in the future. Jason Mack is a doctor, just like our cousin Marilyn and her husband Fred are doctors. But you all two have something.
Duos.
Yeah, two dynamic duos. But you also have something in common. You're Howard alumni.
My husband and 3 kids are Howard alumni. I'm
Just
an
like all of my family.
HBCU, but I'm from Dillard.
Okay.
In New
Okay.
Orleans.
Nice.
All right. So for the audience, just for edification, can you run down your credentials for everybody, please?
Sure. I'm a medical doctor. I've been a doctor since 80. I graduated in 84. I then came to New York and did a nephrology fellowship, which is kidney disease. I always say nephrology is the consultants to primary care. But they usually take care of dialysis and late stage kidney disease. So I don't do dialysis. I use that knowledge in my primary care practice. When I finished that, I worked in primary care and did kidney disease consultants. And along the way, there were so many of my patients in primary care that were HIV that I became an HIV specialist. And I did that exclusively for like 10 years. And then, excuse me, and then I was doing so much HIV care that I noticed that on my outreaches, it was to non-HIV patients. And so I found that they had no idea or how serious HIV still was. And so then I came out of that and did strictly primary care here in Harlem. Everything has been with Mount Sinai, and it used to be St. Luke's Roosevelt. So I've been with them for 20 years.
Okay. Nice. That's awesome, everybody. So we have an official doctor in the building. And the beautiful thing about Real Talk Chronicles, sweetie, is that we have 2 doctors. So the first of the month, Assemblyman Al Taylor, he's running for office. So he's been kind of in and out with us. But the second Monday of the month, we have Dr. Marilyn Corder. Sometimes her husband, Fred, jumps in, our cousin. Okay. And then the third month, we have Allison. And then the fourth month, the fourth Monday of the month, we have Dr. Theresa Mack, and hopefully her husband comes in too sometime.
We're so excited. Yeah, so excited to have you, Theresa.
And everybody, please, if you have questions, please ask the doctors. We're going to go off, real talk. It's nothing scripted, but we just converse with each other, and we just have a good, nice hour and some change conversation. Right. We know she's just coming back, so we're not going to keep her too long today. But let me ask you a question. Just to start off with anything. Anybody, if you have questions, please put it in. And it's so funny, Rochelle, I see you she says, my good friend just had a kidney transplant, I guess.
Okay.
Yeah. Nice. Yeah. So you currently practice at Mount Sinai, correct?
Yes, it is a faculty practice with Mount Sinai. So I am on staff as an associate professor with the Icahn School of Medicine. And they have faculty that we do primary care, but they have a lot of Mount Sinai doctors' faculty practices within the city. and other boroughs, and I'm stationed in Harlem on 147th Street and 8th Avenue.
Awesome. So everybody, you've heard it first. So Doc, let me ask you a question. Let me start off with my first question. With the weather changing and things going on, it seems like allergies have picked up. Do you have any suggestions or things that you would suggest for people that are suffering from allergies? Because you don't know if it's allergies, cold, COVID. There's a multitude of things, RSV. There's so many things out there. But I think right now, I think we can probably just narrow it down. We'll say with allergies. What would be some of your suggestions for people that are suffering from allergies right now?
Okay, well, first thing, when people complain of allergies, they are usually complaining of nasal congestion. It may be a sore throat. They may have runny eyes, watery eyes, and itching. You can have that, but you can also have a sore throat if the allergies are persistent. So you want to make sure that we're just dealing with allergies. And yes, it seems like each season it gets worse and worse. And so what we try to do, and it's also important with allergies that you take care of it if you have asthma, because it can make the asthma worse. So what I usually do is give them topical things to do. Like if it's watery eyes, I ask them to use eye drops. There are some medications that they can use, like Zyrtec, Claritin, and people have tried those. So it seems like if last season you used Claritin, well, this season Claritin might not work. So you would use another one. And so you could do that. Benadryl is also a very good medicine for allergies, but it's sedating. So it's usually good to take just at night. And the other thing is that you can't really take that a day if you are need to be alert or working, because it makes you feel drowsy.
Theresa, I have to tell you, I learned that the hard way many, many years ago. I was
Okay.
very young and I was at work. I'll never forget in Philly. Um, and allergies, they were just out of control. And it was the first and last time I ever took medication for someone.
Okay.
Lady said, "Oh, Benadryl, it's great for your allergies." I kept asking her, "Are you sure it's non-drowsy?" She swore me up and down. And keep in mind, I was very young. I researched the heck out of things nowadays, and that's part of the reason why. But I'll never forget, I was at work, sitting in my cubicle, and I just had to put my head down. I was so embarrassed, so angry. But lesson
Yeah.
learned. Lesson learned. So
Yeah.
it's
No,
not coming from my own pocketbook, or someone I trust. Not doing it.
Yeah, I mean, and it's so funny because recently, I was just having a bout with it, and like Rochelle was just saying, she says her allergies are driving her nuts in Florida. Yeah, so I never suffered from allergies until I got into my mature ages, my mature years. Like, is that something common that you may not have allergies when you're young, but then you can? Is it right to say accrue?
Yeah, yes, you can, because you're forming. The simplest way to think of an allergy is that your body is reacting to something foreign. And so the pollen can change. And so your body is reacting to that. And maybe, when you were less mature, that you had a more robust immune system. And so as we get older, more mature, things that we never ever experienced, you may have. And that is a frequent comment that when patients come, because they have used Dr. Google and they're telling me, well, I've got a cold and I need antibiotics. And so when I say, well, it's allergy, well, I never had allergies before. And so, I have to explain, to them that you may not have had it before, but let's try. And that's the other thing I think that's important, is that you have to have a conversation with patients and you have to have shared, I call it decision making. Whereas I may have the book knowledge, but the patient lives with themselves 24/7. They may see me for the 15 or 20 minutes. And so I'm giving them information, but I have to make sure that it can feed into their lifestyle. And so I have lots of patients that I think I listen more than I do talking. And that really came out of my HIV world, where I was back in the day where there was no treatments. And you basically had to listen to them and see how you could help them. And then when we did get treatment, some of the side effects were really, really bad. And so the guidelines would say one thing, I talk to the patients and they say, no, I'm not going to do that. And then we would just go from there. So I think rather than just constantly telling patients what to do, you have to listen, and it has to be a shared decision making. And patients are always asking for, like with you, Malika, is there any side effects? And I tell them, yes, there are side effects. And we can look online and I can say, but they're not all going to happen to you, or they may, but you have to let me know. And you must weigh the risk with the benefits of the medication.
Like Stefania was saying, she says there are herbal teas that help with allergies. How do you feel about that? That's something that you would suggest, or?
Well, I have never personally had training with herbal teas, but I do know that my patients use herbal teas, and I put all of that into what I call alternative medicine. And yes, it works. So if a patient tells me they're doing herbal teas, that's fine. You may want to, if I say to them, okay, well, do the eye drops and then I want to give you a medicine. And they'll say, well, I saw where there's this herbal tea or ginger, or can I do that? And I say, sure, let's try it, see how you do. And if it works for them, then that's a something else in my armamentarium that I can suggest to someone else. Because what I find in our population, patients don't want to just take medicines. They want to understand, they want to trust you. And if you're constantly just saying, you got to take this pill, you got to take that pill, I have to be able to tell you why this would be important. And we go from there. And if you don't do it, that's fine. That's more reason for you to stay with me, so that I can help you and see if there are any side effects or any complications from that disease. If you're constantly taking your medicines and the chronic disease is under control, then I might see you 3 or 4 times a year, even less. But if you're not taking medications for anything, then I need to see you more on a regular basis so I can assess how you're doing and try to still keep you in good health. And then just make suggestions along the way. As maybe we could try this. We tried your way, let's try my way.
Right. So, Theresa, I have to share this little funny story. When Bill and I first started dating, he came over to my apartment and I asked him to hand me my teacup. You remember this?
I remember.
I said, yeah, Bill, hand me my cup. And he picked the cup up and he's like, Malika, there's something floating around in your cup. He's like, what the hell is this, right? You got something. I'm really big into well, I shouldn't say it that way, but I'm always curious about different types of herbal remedies. So at the time I was getting a root It was OSHA root because I tend to have postnasal drip often. And instead of taking medication for it, I was told that it would help with that postnasal drip. So it was a little piece of bark or OSHA root that was floating around in my tea. And I'm sure you said, what the heck am I getting into?
I was like, this is right here.
Stuff floating around her tea.
Yeah, Malika, spell that for me.
OSHA. OSHA root. I don't even know if they sell it anymore.
They probably don't.
See that brown bag over there, Bill?
Yeah.
It came from that store. It's called Flower Power.
Yeah, she just like spending her money on anything.
No,
they stop. No,
it definitely worked at the time. But so I'm really big into ginger. I talk about that a lot. And so my concoction consists of, like, I can't tell.
Don't tell.
I can't. Bill always tells me, do not tell people what you put. But it does have ginger, and I'm very. It's a very long process, right, Bill? You watched me make it last night.
Yeah.
So let me ask you, how often do you do it, and how long does it take to prepare?
So yeah,
a whole TV show.
I know, right? I feel like I could do a show on it. But I will peel the ginger, and then I take a cheese grater and I'll shave it down. So, I used to just cut a chunk and drop it in, which is fine. But my mom suggested if I shave it, I can get more of the ginger that way. So depending on what's going on.
You do it as a tea?
As a tea. So yeah, I have my big pot on the stove. I get it prepared,
a little cauldron.
Bring it over. Yeah, Bill calls it a cauldron. And then I'll put a few extra other little things. I'll tell you offline, Theresa, what else?
Okay, no, that's good.
It works. Teddy said spill the tea. Yeah. Yes, Dana. Turmeric is in there as well.
Yeah.
Apple cider vinegar is in there. But I'm big on like just trying to find ways to naturally get rid of the mucus. And that's what I've been saying to Bill. He likes to smoke his cigars, and with the weather changing, there's a lot of grass and trees around us. So that's been my thing is, and then I did get the Flonase, right? So Flonase, Tylenol, and my specialty. And he's been really good about drinking it. In the beginning, he's like, I'm not drinking that, stuff. But now I'll just hand him a cup and he'll drink it.
And Bill, is it helping your allergies?
I guess so. I mean,
Bill, come on,
50% marriage, 50% allergies.
That just means it's more for
me. Hey, everybody, this is Real Talk Chronicles with my co-host, Dr. Theresa Mack. This is your foster in the moment, Real Talk. Tajid Jet says, they say doctors make the worst patients. How is Dr. Mack as a patient?
Oh, that's a great question.
Oh, it sure is. I think as I tend to doctor myself. Okay. So I won't say I'm the worst patient, but I tend to not go to my doctor as regularly as I should. So I'll go every 2 years and I'll do my blood tests. But what I do is I try to eat a healthy eating, exercise regularly, limit my alcohol intake. I don't do any drugs and I don't smoke. Right. So I try to do that because those are preventive things that we can do that will help healthcare disparities among Blacks and all of our diseases. And we seem to be leading in just about every category of a chronic illness. So that I do. I wouldn't say I'm the worst patient. My doctor, he does love seeing me, and we sit and we have almost like this Real Talk Chronicles. Okay, we're sitting going back and forth. So thank you for that question.
Thank you.
Yeah, I'm glad you asked that too. Every 2 years, Theresa, we're going to have to get on your case.
Yeah.
But I do my mammograms
Yeah.
every year, and I do my pap smears. Okay,
Yes,
and
of course.
I'm into immunizations, and so I know that's a controversial issue, but I do it to protect patients, primarily that flu vaccine, and then the COVID, and then I stay up to date on all of my other preventive things.
Mhm.
So, and I work with a other group of doctors. So, I may not go to my doctor, but if I'm having a cold,
Right.
my colleagues, look at my ear, look at
I'll
my.
have to send over a pot of that specialty for you.
Yeah,
Theresa.
give it to her. Yeah, exactly.
All right.
We got you, Theresa, on that one. So let me ask you a question, and I forgot to ask Marilyn this too. If something feels funny or something, do you ask Jay, like, or does Jay like try to be doctor with you, or he's just like, you
No, he has his own doctor, and I have my own doctor. And my 3 kids, my husband is a pediatrician.
Okay.
My 3 kids had their own pediatrician. So it's very hard to take care of family. And so sometimes when I think he realized when we first was married that I'm not going to be able to tell her some of these instructions that we need to be telling these kids, like the pot handle has to go away, and so he was like, we monitor these patients, the moms, and we have lots of things. He said, I think you should get a pediatrician. And so I did. I found one that I had used when I was in training, and I saw him in action, and I used that. But it is better. And we will run things off of each other. Like, he'll say, my blood pressure might not be is high today, or I'm having these symptoms. We'll go through it, and then I'll say, okay, we better call your doctor. Now, the one nice thing is, and this was even with my friends, was that he could take care of acute problems. So sometimes you couldn't get your pediatrician. So he would take care of our kids and things like that. And my friends, if they had asthma, their kids and stuff. And so they would feel very uncomfortable. They would say, oh, I don't mean to disturb him, but my doctor, you think he would get mad? And I was like, no, your doctor going to thank him. And I said, I don't think that would be the case. And so she did mention it once to her doctor, and he said, oh no, if he's there and he can take care of the acute asthma, then that's fine. One thing I noticed, and so he'll be on the show at some point, but at one point I had to put my foot down because he's a pediatrician. And so if the kids were not near a respirator and had, needed to be on a respirator, they could go to school. And I'm like, come on now. These kids.
You went old school. He's like, get out of the house.
No. And I had to tell him, you send them to school, and then they call me and I got to leave work and pick them up. So I said, just because they not in the ICU does not mean they not sick.
Absolutely. Knock it off. Shout out to my man, Jay. Everybody, this is Real Talk Chronicles. If you have any questions for the doctors, please write them in so we can answer. Doc, is there anything that you want to discuss and talk about tonight?
Just before we get too far off the topic, I did have one question regarding people with hypertension and allergy medication. Because we talked about the Benadryl, the Claritin, but with someone with high blood pressure, is it safe for them to take those the same medication or something else?
Yes, you can. What you worry about with high blood pressure is that some medication will interfere with it and will cause it to not be effective, so your pressure could go higher. You're more concerned with like the the decongestants or the it's almost like an amphetamine type of response where your blood pressure will go higher. So I always tell patients, if you have high blood pressure, you have a blood pressure kit, self-monitoring kit. And so I say, when you take the medicine, just check it and see, has your blood pressure gone up?
Mm-hmm.
And are you feeling in any medication? Is it going up? Do you notice any, particular side effects? And let's talk about it.
Sure. Got it.
Mark has a question. Doc, I don't know if you can see it, Malika. You can read it.
Mark said, can you, I'll read it for you. He said, loving and enjoying this. I do have a question. How important is it to get direct vitamin or minerals from your food? Zinc, vitamin C is important. Are supplements the best source?
I don't think supplements are the best source, but they have a role. I think we should get all of our nutrients from fresh fruits and vegetables and organic, so that there's no pesticides. But if not, you can wash the fruits and vegetables very well, so that you can get them from your foodstuffs. But I do have patients that I have to, put on a multivitamin. And zinc, really around flu season, I'm telling people also to take those things. So I don't think supplements are the best. But if you're not taking any medicines and you're trying to prevent something, then your Zicam and your zinc, ginger, apple cider vinegar. I think apple cider vinegar, to me, I consider it a supplement, but it really helped during the COVID era. And now whenever I get a little sore throat, is that apple cider vinegar and honey. And again, these things I was not taught in medical school. This is coming from conversation with my patients and with my friends.
Absolutely.
Okay.
Yeah, we have another question from Andre. He said, are you familiar with PLU codes for fruits and vegetables?
No. Can he enlighten me?
Share, Andre.
Come on, Andre, please tell us. Enlighten us.
Do tell. And Mark said, thank you. And he said, and I appreciate you taking the time to answer my question.
Oh, no problem.
Yeah. What did Rochelle say?
Rochelle says zinc and vitamins are essential now, especially with flu season. Honey is also important, correct?
Yes. That's it. But I think she's telling me that's what she's doing. That's fine.
Yeah.
Hey, Rochelle, is that what you're telling us? Holla at us, sis.
I know I used to get sore throats a lot when I was a little girl. And I just remember my mom putting honey and squeezing some lemon and mixing it around. I did that for you the other night, Bill. It's those good old remedies mixed in with medicine as well that help.
And I mean, we have to remember that, the pharmaceutical industry is big now, but back in the day, it was, you would just go out in the garden and get something, and your big mama. Yeah. So,
big mama, as you said, exactly.
you can never discredit it. I mean, just because I wasn't trained in that form of medicine doesn't mean it doesn't work. And I do have to, look through things and look up things so that I can, have a sense of something to suggest to a patient.
Understood. Ty has a question. Go ahead, Malika.
So Ty says, why are the BMI charts so unrealistic? It makes it seem like everyone is obese.
I know. Um, um, BMI or body mass index charts, and I think they are unreliable, um, because they are not based on like your bone structure. So you could be big boned, small boned, and again, he's absolutely correct. Everybody is either going to be overweight or obese, with the numbers of how it's being calculated. And I think the medical world is trying to get around that and find a different way to measure. What I think you need to remember is that you can have, so let me give you, a BMI of less than 25 is considered normal, and 26 to 30 is considered overweight. So everybody that I see just about is overweight. And then over 30 is obese. And then we have a term, morbidly obese, and that's like a BMI of 40. And that's when you're, 5'11", not 5'11", 5'1" or 2, and you're like 250 pounds or more. What I try to get people to do is to exercise, eat healthy, and not pay so much attention to the weight, or this BMI, because a lot of times when you have that BMI over 30, the guidelines say, well, you need to be offering them these weight loss drugs or refer them to bariatric surgery. Whatever happened to eating healthy and curtailing your diet and increasing your physical activity? So um, I know what the guidelines are, but I don't follow them to the letter of the law because they are just that, guidelines. And if I did that, a lot of people would just leave because they won't come back. I'm trying to get you to come back. I'm trying to get you so we can have a conversation and come up with some healthy outcomes for both of us. And the other thing is, people don't like to hear the word obese or morbidly obese. So to get around it, we just say your BMI is 40 and normal is less than 25, and we want you to be in that range of 26 and or 27, 28, and that overweight is better, because we do know obesity comes with all of the chronic medical problems that we have, diabetes and hypertension. So
all those things culminated together, right, Doc? Yeah, all those things add in here.
Mm-hmm.
Yeah. Andre, go ahead, Malika.
Yeah, I'm gonna just read a few things. Andre was talking about the PL.
Oh,
the PLU codes. So he said, yes, it's the numbers on the peel-off sticker on the fruits and vegetables, which lets us know if the fruits and veggies are GMO or not. The first number represents how it's grown. And then he said any number that starts with 9 means organic. 3s and 4s means it's sprayed with a pesticide. And then he said 6, 7, 8 means genetically engineered. And then he said, of course, seedless is not real. It's very, very strange seeing some of these seedless fruits out there now. But yeah, he said it's made in the lab.
What do you mean by seedless?
It's not real, made in a lab.
Oh, yeah, okay. Okay.
So yeah, Thank so those are the PLU codes that Andre talked about.
And that was Andre. Okay, so thank you very much.
Yes. And then Rochelle says, my
Mhm.
West Indian tribe and my remedies books, New York City raised across Lincoln Center. Another one is, oh, don't forget lemons and lemongrass.
Okay.
Yeah. Thank you, Rochelle. Teddy Ted has a question. What can we do to fight or deal with osteoporosis, which was from the medications I've been taking because of my sarcoidosis?
Okay. All right. So let me explain for the audience, and I'll be answering. It was Ted's question.
Yes.
Yeah. Okay. So osteoporosis is where your bones become very thin. And if they're thin, they're not sturdy, and that you can have falls and fractures. And so there are some medications that do that. Sarcoidosis is like an autoimmune disease where your own body um, is is fighting against itself. And so to use medicines to calm down that immune system is steroids. And steroids are known to make your bones thin. So we tell people to do calcium and vitamin D. Once you have, and to get screened for osteoporosis in women and even in men, but over 60. And the the way that the bone density test is basically that it's telling you how thick your bones are or how thin they are. And so it could be normal, or it can be osteopenia, which means you have less calcium in the bone, and then osteoporosis. And so we tell patients to take calcium and vitamin D. Once you have osteoporosis, you still need to take that, but you would need something to kind of help build back that bone again. Um, and depending on how bad your osteoporosis is.
Mhm. Thank you for that.
Mhm.
We have another one from Eddie Vieira. He said, hi guys, I'd like to know Dr. Mack's opinion on hip replacements in my far future. Is she for or against them? He said, I have arthritis and pain on a hip, but Advil usually takes care of it for now.
Okay. So, no, I'm not for any surgery unless it's absolutely necessary. So, if you're taking Advil or any herb that can curtail your pain, then you don't need to have uh, surgery. Um, with arthritis, and it depends on the patient. I usually say to them, what do you want to do that you can't do now that you have this arthritis? And if they say, well, I can just do about everything, it's just a little slower. And is that a problem for you? You want to find out what is the quality of life with that particular patient, because that's what's important to them. When patients say that they have arthritis, um, and it's in the hip, if it's very severe, it's going to be bone on bone. You're going to be in constant pain. You're not going to be able to walk that well. That's a change in your quality of life. And if you're constantly in pain, then you may think maybe now it's time to see what else you can do. One of the things that I do with all my arthritic patients is I do send them to physical therapy. Some patients, so that they can learn how to function with that pain, or or occupational therapy, which the difference is if you already have a limitation, they show you how you can, with that limitation, do the things that you usually do. I've offered acupuncture to my patients with arthritis, back pain, sciatica. Um, so I'm not against hip surgery, but it's not my first line. I wouldn't be telling the patient hip surgery. The scenario that I see it is if I sent a patient to the orthopedic specialist and they come back to me and I'm going and I said, well, I see their notes. What did you think about the visit? And they want to cut. And so I said, well, you know, are you in that much pain? What were some of the procedures that he did on your maneuvers on your joints? And so the orthopedics may have recommended surgery, but the patient will say just like this, Advil takes care of it for right now. So if that's the case, let Advil take care of it.
And Doc, let me ask you a question, or let me have a conversation with you. A lot of times, I think, or for all the surgeries I've had, there's always a process. And we was talking to a friend of ours, a family friend of ours recently, and usually when somebody gets diagnosed with something or something kind of ailment comes up, usually what is the process like? Medicine, therapy, like you just were saying, then what's maybe epidurals, cortisones, and then maybe the worst case scenario surgery. Is that how the process goes?
It really would depend on the symptoms, okay? But an epidural is in the middle, okay? You have arthritis. Tylenol is a safe and a wonderful medication if it's taken properly. So you would do those type of medicines, and we also call them non-steroids. And so you would do that. If that doesn't work, we're doing x-rays to see, is there a fracture? Is there some misalignment? Even in your back, is the curvature or is the scoliosis? Those things kind of tell you which avenue to go. When you send them to pain management, and most of the doctors now who do pain management are anesthesiologists, and so they will do cortisone injections or epidurals to help for the pain. And sometimes that does work. But if it is a severe case, you're taking that injection and then it may last for a week or even less. And then you still have the pain. So it's not that you want to tell people you got to live with pain, but you have to come to a happy medium. If they don't like epidurals, if they don't like injections in your joints, and they're really in a lot of pain, the only other solution is surgery, unless you want to live with that pain. But it is a process. Nobody should go from seeing your primary care doctor with arthritis and sending them to orthopedic and they're saying surgery. And most insurances, again, will not even pay for the epidurals or the cortisone injections or the gel injections unless you have followed uh, a different course and you have exhausted all of the preliminaries that we would do with the medications, heat, cold compresses, copper socks. You try all of these other things first before you do the big guns.
Yeah, because just transparency with my knee, it's not bone on bone yet, but it's arthritic, and I do get the gel shots in the knee right now, and if I need to. he'll tell me
And
to come
how
and get
long right? How long does it last for you?
You know, to my own dismay, I have a high threshold of pain, so I try to do anything I can to not show signs of vulnerability or weakness. But if it swells up, then I'll be like, "Yo, doc," you know what I mean? It's time to get a shot or something like that. But I'm fortunate right now that sometimes I'm able to stay off it, and hopefully the swelling will reside in that magnitude. We have everybody. If you have a question for the doc, put them in. This is Real Talk Chronicles with you're fostering the moment, Real Talk Chronicles style, with our co-host Dr. Theresa Mack, and she's here with us the fourth
Monday.
Go ahead.
Every fourth Monday of the month.
Fourth Monday of the month.
Yes.
And listen, it's only going to get better. This is Real Talk Chronicles. We have something else with CC Local.
Yeah, so CC Local, it says vitamin D is not part of the annual physical check. Is this based on the insurance companies or the medical industry? How can individuals push to change this?
Okay, well, vitamin D testing is relatively inexpensive. So when you do your annual physical, if your doctor doesn't order it, you can ask them to prescribe it for you. Most people of color will have vitamin D deficiency, and that is because vitamin D is made in the skin. And so the sunlight makes the chemical in the skin of vitamin D, and then it goes to the kidney, and the kidney makes the active form of vitamin D. But melanin, our pigment, blocks it. So people of color usually have severe vitamin D deficiency. And when I say severe, I mean if the range for normal is between 30 and 100, and you over 100, if you're on supplements, we tell you to stop. It's too high, you can have vitamin D toxicity. But most people are less than 30, which means that they are vitamin D insufficient or deficient. And so, yes, it's a supplement that you should take. And again, if you order it, the doctor orders it, and everything gets covered but vitamin D, you can then ask your doctor to write a letter to the insurance company. This was necessary because such and such, and so that you can uh, be reimbursed for that.
Real Talk Chronicles. I'm your host, Bill Forster, with my co-host, Malika Forster, with our co-host, Dr. Theresa Mack. If you're watching it, please share it. If you're watching it from Facebook, please share it. If you're watching it from YouTube, subscribe to it so we can give you more content like this. Every Wednesday, we're trying to be here more. And I see one of my co-hosts, Richard Williams, is in the building. He has some questions and comments. We'll get to that too. But we appreciate all the feedback. We're going to try to get to as much as we can. And I know the doctor wants to talk about something too. So we're not going to push her too late tonight. You know, she just came back off her trip, and, you know, we want her to get her rest. So usually we try to stay between that hour and a half or that hour and a half the most. That's it. So, Doc, if we get too more into time that you're ready to go, just let me know. Just give me the you know what I'm saying? You got another 15 to 20 minutes for us? You good?
I'm good. Okay,
good. All right, everybody. Go ahead, Malika.
Thank you. So yes, and thank you everyone for your patience. We're going down the list. Andre C., thank you for that. So we talked about PLU codes earlier. He wrote that they're product lookup codes. Yes, and I believe Dana said that her nephew says that there's an app for that. I'm sure, and there's also our friend Google as well. Earl, yes, let me put this one up here. So Earl says, Okay. So Earl says, sadly, our food, in quotes, is grown in mineral depleted soil. It literally takes more than 100 bowls of spinach today to get the same nutritional value of one bowl of spinach 100 years ago. And the vegetables are bathed in pesticides. So it makes sense to supplement your diet with high quality nutricitials. I hope I'm saying that right or close to right. Some in general, like D3, K2, magnesium, vitamin C, etc., but also depending on your specific health needs or concerns. I'm concerned with glucose metabolism and artery health. So I take Burbine, and it's cut off. Burbine, is it berberine and NATTOK ... I'm not sure where the rest of your message is, Earl, but that's all we have here.
Okay. So he's saying he's concerned with his glucose metabolism and artery health. And so glucose metabolism, that would be more or less you're concerned about your sugar is not being properly used. When you eat your foods and it gets broken down, sugar is used, is in the bloodstream, and it is the fuel that's used for all of your cells, your brain cells, your heart cells, your muscle cells, your kidney cells. You want the sugar in the blood to get into those cells. And so the way that that's done, how our body does that, is with insulin. And so insulin will push the sugar into the cells. If you don't make enough insulin, that's what we call diabetes, and there's two types. And you could also make enough insulin, but the cells don't respond to it. And so when that happens, your body continues to make more insulin to try to get the cells to like just bombard it so that the sugar can go in. When that happens, we say that's insulin resistance. And that is significant because insulin resistance is one of the ways that you become fat, because insulin is a fat storing hormone. And so if you just use a little bit of insulin to get the sugar in, you're fine. But if you have a whole lot of insulin that had to push in just that little bit of sugar, all that extra insulin gets stored as fat. So that's what we talk about when we say glucose metabolism. We want you to be in a normal state. And so you could be normal, you could be pre-diabetic, and he's talking glucose metabolism, but the term that I want to use is the diabetes, pre-diabetes, or impaired fasting glucose, and then diabetes. And again, you want to make sure that your doctor is sending you to a nutritionist, a diabetic educator, so that you can know everything that there is about glucose metabolism. One test that is used is this hemoglobin A1C. And the hemoglobin A1C is the coating of the red blood cells with sugar. And once the red blood cell gets coated with sugar, it stays coated with sugar for the entire lifespan of that red cell. And the red cell lasts for 2 to 3 months. So we have a test where we can look at the red cell sugar level. and normally it should be less than 6. But if it's over that, whether you have fasted that day or not, it's actually measuring the sugar content on that red cell. And so that gives us a better prediction or idea of how your sugars have been in the past 3 months. So, for example, if a person has a hemoglobin of 7, that's if you were diabetic, we really want it to be 7 or less. But if it's 8, 9, 10, 12, 15, that means your glucose metabolism is out of control, that your own cells are not getting the sugar that they need. And you'll have tiredness. You'll have the symptoms of your body has so much sugar in the blood that it gets filtered by the kidneys, and the kidneys are saying this is just too much sugar. So it's eliminating sugar and also waste products. And you just have no energy. You could be confused. You could have high sugar in the fluid in your eyes. You can't see that well. And then the main thing, I think, when you have high sugar in the blood is if you get a cut, then the bacteria that get attracted to that cut, it's like a buffet for them, because they're just getting more and more of food from your sugar, and that causes infections. So that was what glucose metabolism is. And what was the other thing that the gentleman said he was concerned about? Oh, and arteries. And so I like to make the analogy of with your arteries is like pipes. And so if your arteries are normal, blood can flow back and forth easily. If your arteries become narrow because of high blood pressure consistently, or you have clogging of your arteries with substances like cholesterol, then the blood cannot flow through, and it can cause those pipes to clog up, and so nothing can get through. And so yes, preventative for that would be healthy living, eating habits, and exercise. And I can't comment on the things that you're taking because I'm not trained in that. But if you have a primary care doctor and you're telling them that these are the things that you're taking, and he's looking at your numbers, and you should have a pretty good result. And if not, then you may want to think of doing some other things.
Thank you, Doc. I appreciate that. Everybody, this is Real Talk Chronicles. That's Theresa Mack. This is Real Talk with Dr. Mack and your Foster in the Moment. This is Real Talk. What else we got? There's a lot of stuff going on here. A lot of people chiming in and saying hello.
Yeah, I just want to say, Andre C. I think I'm talking to Andre Capers. Say hi. I didn't know that was you. I just read it. He says, I'm a holistic health practitioner here in Philly. Yes, we do know, Andre. Good of you to join the show.
What's up, bro?
Richard Williams, he said, well-needed conversation about the conditions in which we live in as it relates to our own intake.
Absolutely.
Ooh, that's
I know, Rich, I saw something. You had something about your knee, too. We'll get back to that. He said, oh, there he is right there, Rich.
Yeah.
Okay, Andre.
Yes, I don't want to skip this one. So Andre also said, how does the doctor feel about recommending a chiropractor for sciatica from misalignments in the lower back area? I find that most people get it from side sleeping.
What, the sciatica or going to see the chiropractor?
That's a good question.
No.
Andre, holler back.
No, a chiropractor I use, and it's very good for all back pains. And it's amazing what they can do with manipulating the spine. I have no problems with that. And most insurances now will cover my referral to a chiropractor, acupuncturist, occupational therapy. And so you want to make sure that you do things first that don't really require medications.
I agree. Thank you, Theresa. The next one is from Richard. He said, I was told that I was going to need a knee replacement last year. I was getting cortisone shots, then gel shots, and they only made things worse. I found something that works for me, and it's called the Neuro Knee Massager. Nooro knee massager.
Okay. And he says, is he saying that that works?
What's up, Rich? Give us more.
Yeah, Rich, does that work? Yeah, go to the next one.
Yeah. Oh, wait. I scrolled down. He said, no more swelling or pain in my knees.
Oh, fine.
That's it. Well, why you didn't share?
Do the happy dance.
Why you didn't share? Why you didn't share with your homie? What's wrong with you?
I know, right? I'm gonna have to look that up on Amazon.
Yeah, me too. Look, guys, I've been taking notes.
I see you there.
That's what's up.
Teresa, I have my little notebook here too. I'm a big note.
But you know what's so funny, and that's so beautiful, and that's what Real Talk is about: transparency. Even though you're a doctor in the field, you're still learning as people are asking you questions as you're going along, and that's why we love you, Theresa. Because the bottom line is, you ain't ashamed to say, "I'm gonna take notes and I'm gonna research it." You know what I'm trying to say? Because that's what it is. Yeah. Go ahead.
Well, thank you.
Yes. So CC Local says Dr. Mack is referencing the doctor during the discussion of arthritis. When does one with arthritis need to see a rheumatologist?
Okay. I don't think that arthritis, just simple arthritis or osteoarthritis of your bones that you get either from excessive wear and tear. I think you need to see a rheumatologist if the arthritis is due to other things. For example, if you have a skin condition, psoriasis, and we're not sure if your arthritis is due to that, then you should see a rheumatologist. If you have arthritis that's on both sides, that's more consistent, both sides of the joint, I mean, hip, the knee, that's more consistent with rheumatoid arthritis. And yes, you want to see a rheumatologist for that. Your primary care doctor can do the initial, which would be you an X-ray, start you off with the massages, the copper socks, and Tylenol. But if those don't work, you can move up to the Motrins, the Celebrex, and then at that point you can see an orthopedic. But a rheumatologist is someone who's dealing with the joints, or they are dealing with your immune system going awry, meaning that your immune system fights off infections or bacteria. And those are foreign substances. But you see a rheumatologist when your own body starts to make antibodies against your body, okay? And they're taking your body as being foreign. And so that's one of the ways with lupus works. And so for that, you would see a rheumatologist. You don't need to see a rheumatologist just for arthritis.
Thank you, Theresa. So Ty says, Doctor, what do you think about people Googling their symptoms? I can tell you from experience, Google seems to give the most severe diagnosis. Runny nose equals death. And then she says, and a stomach ache equals more death.
Yeah. No, it's funny because that's exactly I like an informed patient. Okay. So yes, you can. I use Dr. Google. Most of my patients will use this a medicine or MD consult, but I like to see what Dr. Google has. But yes, even let me give you an example for like colon cancer. You can have this change in your bowels, blood in the stool, little weight loss, and that could be the beginning of colon cancer. But it could be a whole lot of other things that it is not. And so you have to be careful when you're doing Dr. Google to really talk it over with someone else. And I like to just go a little bit more on colon cancer because this is the colon cancer month and we're at the end of it. But we want to be able to catch colon cancer early. And so there are some signs. And so you can have, like I said, the change in the bowel habits, the blood in the stool, some abdominal pain, unexplained weight loss, and fatigue. But it's essential to remember that most of the symptoms that you see here and in Google, there are less serious conditions than cancer. And that's why it's crucial for you to talk with your doctor if you're experiencing any of those symptoms. And so to screen for colon cancer is important because you can catch it early, and any cancer that you catch early is treatable and more often is curable. So screening tests in colon cancer, you're forming cells that form polyps, and those polyps are, I call them like little lollipops on the side of your intestine. And so it takes almost 5 to 10 years for that polyp to that little lollipop to go down the stick and get into the colon mucosa and cause cancer. So we now screen for people who are 45 years of age or older, and if you had any of those other symptoms, and if you have a family history of colon cancer, you need to be screened. And there are two types of screening tests, and I want to talk about the gold standard is this colonoscopy, which is a doctor puts a flexible tube with a camera and a light, and it can actually see your intestines, and it can see if there's a polyp. And that is a painless procedure, but you don't usually have something going into your rectum. Your bowel movements come out. So patients don't like that. But the entire procedure takes about 30 minutes. The one that I've been referring a lot to my patients is one called Cologuard. And it has a cute little commercial on TV where he says, I get colon cancer my way. And it's a little box. And it represents the box that gets mailed to you. And you would put they give you all the instruments and gloves and sticks, and you would put your stool in that, and then you send it back to them. They will then see if you have the colon cancer gene. And if you don't have it, then it's a negative test, and you could do it every 3 years. For the colonoscopy, it's every 10 years. But if that Cologuard test is positive, you would still need a colonoscopy, but it doesn't mean it's a positive Cologuard that you have colon cancer. It just means that it could have been blood in the stool. It could have been a lot of things. I do have a lot of patients that come back positive. And I won't say a lot, but we have to go with the colonoscopy. But a whole lot of my patients, I can get them to do the Cologuard because it's not invasive and you get the results. And I just wanted to mention that because this is colon cancer screening month.
Everybody, this is Real Talk Chronicles. That's Dr. Theresa Mack. You are a forcer in the moment in the Real Talk time. You got Doc. We got 10 minutes for you. I'm gonna let Malika. If you want to finish what you were saying, I don't want to interrupt you. I apologize.
No. I just wanted to say that the Cologuard test is not for someone who has a family history of colon cancer.
Okay.
So it is good for people who, for years, I've been saying, let's get the colonoscopy, and they won't do it. But this way, when I explain to both types, they say, I'll go with the Cologuard. And then if they have a family history, we have to go with the colonoscopy.
Absolutely.
Thank you. That was great information.
So what Malika's going to do, she's going to read some comments. Even if they're questions, she's just going to read them. I don't want you to answer because I know there's something that you did want to talk about. And I want to give you the last 10 minutes so you can talk about the thing that you mentioned earlier to us. And then we can, if there's time, we can wrap it up. But if there's time, then she can answer any of the questions. But go ahead, just read whatever comments and questions and we can get out of here.
So Andre said celery, just put it on the screen. Celery Husi number 9 helps the kidneys and cholesterol. And then he put in parentheses, plaque buildup in the arteries and veins. He says red onion tea also helps.
Okay. Now, is Andre the holistic practitioner? Oh, okay. So I would like to talk with Andre offline.
I can definitely arrange that.
Okay, good. Okay.
Richard says, is there a test you can ask? Is there a test you can take to find out if any of your arteries are blocked?
Yes. So let's see. For your heart, there's a CAT scan that's of your heart arteries. So they could do that particular test. They could also do other, like, measure your heart activity level with an EKG, and if they see that it's not going through, or the activity is not going through, they would want to look directly. So that would be a cardiac cath. But the cardiac CAT scan is one way. Now, your arteries and veins, we call those peripheral, because central is your heart, arteries and veins are peripheral. You can have peripheral artery disease, and that can be done by a sonogram, a Doppler ultrasound, and it can measure the flow in arteries and veins and can tell you which of your arteries have a blockage.
Thank you. Richard also says, I was in the mall in New Jersey where they have Chinese people giving massages, and I told him about my knee, and he massaged the pressure points in my knee. And when he finished, I had a new knee. So I saw the advertisement for the neuro knee massager, and it talked about the pressure points in the knee and how the neuro works to repair your cartilage. Thank you, Richard.
Yeah, excellent.
CC Local says, Ty is so right. However, Dr. Google led me to ask my doctor to test my vitamin D and ferritin, and both were extremely low. Richard also says, Bill, I couldn't walk up or down the stairs without pain. I couldn't even get a good night's sleep until I found the right position for my knee. He says that he does not have those issues anymore. He can play ball again. No, hell no. But I can get around without the pain. Yes.
He can get around without the pain.
Without the pain. So I guess he's not playing ball, but we see
Okay.
him.
Now, is this the
He's
same
getting a
one?
long time.
He's using that neuro knee
The neural massager.
Yeah, I'm okay.
Yeah, we're all going to Google that.
Yeah, I tell you.
I was like, we need it, right? NP, yes. So NP Beckford says this was a great segment. Sorry I missed the beginning. Where do you practice medicine, if I may ask?
Sure. Okay. I am at 147th Street and 8th Avenue in Harlem, New York. It's Mount Sinai Doctors Faculty Practice. I'm the medical director there, and I have 7 physicians that also are there.
If you go there, just say real. You saw on Real Talk Chronicles.
That's right.
You get put on a waiting list.
No.
I was like,
all right. And last one, Sharon says, does the doctor recommend colon cleansing and can recommend someone?
Okay. Now for colon cleansing, I don't recommend, but my patients do it anyway. The reason is we know that the body cleans itself. And so we think that with colon cleansing, you're getting rid of maybe more of your good bacteria than your bad bacteria. They both have to live together, and the good bacteria keeps the bad in check. So I asked my colleagues who were GI specialists, and they said, no, we don't need to do that. So when I went back to my patient, I said, they're not recommending it. She said, well, I already tried it. And I was like, okay, how did it go? And she said, well, it went fine and I feel good. So I'm like, okay. So when patients say that they want to do it, it's not something that I was trained in, but people do it and they don't. I was fearful that they would be doing it like once a month, once every, once a week. And it isn't that. And so again, listen to the patient. If it's not going to harm them and they're doing okay, then it's okay with me.
Absolutely.
Great. Thank you so much for taking the time to answer everyone's questions. We're pretty close to time. We want to give you the last few minutes so that you can share the information that you wanted to with the audience.
Yeah, no, but I've been doing it all throughout.
Okay.
I found a way to incorporate it. And basically, I just wanted to put in a plug for primary care medicine, that it's not just treating chronic diseases, it's preventing them. And you can prevent all of your diseases, the breast cancer, the prostate cancer, lung cancer. And next time when we talk, I am going to talk about lung cancer because there are some new ways to screen. And I want to talk about kidney cancer because there is a new gene that we need to know about called APO1 that's prevalent in the Black community. So diabetes, hypertension, heart disease, those are illnesses that we can prevent. And we need for you to come see your primary care doctor so that we can do that. And I was just going to just go into a little bit more, but I was able to cover everything that I wanted in everybody's questions.
Well,
So
that's
awesome.
I appreciate it.
Yeah.
So Doc, I'm gonna ask you online and not in the green room. How was your first Real Talk Chronicles? Did you enjoy yourself?
I loved it, but you know what? I had seen it before, and it was around COVID time.
Right.
Okay, and again, I was like, oh, that's interesting, and the information was up to date.
Right.
But when you said to me a living room conversation, I was all for it because that's exactly how comfortable you need to be to explain some of these concepts, okay? And you can't have it such that it's my way or the highway, else nobody's going to learn anything. So yeah, I loved it. However, I didn't know, and I'm perfectly happy that I was going to be the fourth Monday or the fourth Wednesday, but that's fine because
if that work with you, or you need another day, you let us know.
no, what day is it? Is it Monday or Wednesday?
It's a Monday.
It's Monday. Okay. Did you used to be Wednesday?
Well, we still do Wednesdays, but I can bump somebody on a Wednesday if you need me.
No. It is fine. I had actually told my family about it because my husband Jason, but I got 3 kids and they're all doctors, and so the last one is graduating. So I told them, I said we could go on as a family and just have questions. So
and they can all get their own days too. You let me know what you need me to do. Malika and I. Let me tell you something. What's so important to me? I mean, everybody knows. I have a history of making everybody happy in the turn up aspect, with Row House and other things that I've done, promotional standpoint. But with Real Talk, for those that don't know, it all came to fruition after the transition of my mother, and I knew I needed therapy. And I used to talk about this with close friends, and I understood that that's what I needed. I didn't want to go to a clinical person, but I just wanted my friends, and we just started conversing about our upbringing, because our upbringing is how we transformed into who we are as adults, good, bad, or indifferent. But then, we used to talk about why he, she don't want us and love us. And I felt like, we evolved, and Malika was like, listen, you married now, we doing some other stuff. She said, and then when the pandemic hit, she was like, revise your Real Talk. And this is how we came to doing the Real Talk. There's your patient right there, Agnes Alvarez.
Oh my goodness, how are you?
That's my neighbor. I grew up with Agnes, right there. Agnes, So so that's how it all came to fruition. And right now, I tell people all the time, like, positivity is the hardest thing to sell. But the bottom line is, with Real Talk, this is my platform, Malika and I platform, and we're going to put out the best content we can. So that's why on Wednesdays, like Stefania affectionately calls us the Cop Crew, we get together and we talk about situations and politics and law enforcement. But with the Mondays, I have Mondays allotted for good information, like with you, Dr. Corder, and things like that. So, you can always bring your family on. Let me tell you, I push people to the side for giving good information, like the doctors. So we're gonna have a Mack family on this joint, right?
That's awesome.
And I'm serious with that. I'm serious with that, Theresa. Really.
Okay.
Because, you can tell your family they're more than welcome. They can come on with you if they want their own little slots. We can get it. If I can't do it, Malika can do it. We are here to give information to the community the best way we can, and I mean that wholeheartedly. I don't care if I do a show about doctors every day. It doesn't make a difference, long as we can help our community, white, black, Spanish, whatever your ethnicity is. Health is health. You know what I'm saying? And that's Real Talk. So that's what we want to do.
Right, and health is wealth, and so like I'm listening. There's a lot of holistic, and so we need to get someone, and maybe you've already had it, but that would be an excellent segment to have a holistic and have a traditional, and we give this, the information together. I would love to do something like that.
We can do it. It's done.
Yeah.
You awesome. Listen. This is your show. Yes. So I want to listen. This is your show. So all you got to do is just tell us what you want, and we'll put it into motion. So we'll get somebody like Andre C, who's a holistic person.
He just said he would love to come on. So I'll definitely set that up. We can connect. Yeah, it's good to see you too, Dre.
Yeah, and then also too, like I said, I know next week you want to talk about certain things, but we'll talk sidebar, and you let us know if you want to get the family in, because like I said, we have Wednesdays. We can add days. The bottom line is, as long as we can give back to our people. Any people, and when I say people, as long as blood runs through your veins, but especially people of color, black and brown, and no disrespect to our Caucasian family, we love you too, but you know what I'm saying? This is information that we need everybody to pass. I ask you all, please, whatever you've heard tonight, if you are watching it from Facebook, share it so the information can get out. If you're watching it from YouTube, subscribe to it. If you're not watching it from YouTube, can you go to YouTube and subscribe to Real Talk Chronicles so we can keep building the content? Right, sweetie?
Absolutely, it's free. Right? It's free. We always say that. It's
knowledge is
the easiest way to support someone is just to share that information, especially if you appreciate it. So I don't know if you were able to see this, Dr. Mack, but I've been clicking through. You're getting a lot of love here.
Oh, good.
Yeah, everybody put some hearts in for Dr. Mack. Put some hearts in for Dr. Mack.
A lot of love.
Knock it off.
Helen is here as well.
Well, Helen was in the building.
Yes,
Helen was fabulous.
Exactly.
Okay, thank you. No, I can't. It's small. I can't see it, but thank you. Thank you for letting me know.
They're saying this is awesome. Tons of thank yous. It's fabulous. Shouts out to your family. My former coworker Suzanne said very informative. Thank you. You're getting so much love here. This is on YouTube and Facebook.
Right.
So we really appreciate you.
So the one thing we always do when we end is we always give out some positive affirmation. So Doc, we're gonna let you close out with some positive affirmation. Whoever's on the show, we always have to end with positive affirmation. So go ahead, Doc, and then we're closing out.
Okay. So I think a positive affirmation is you should say to yourself, I am the best that I can be. I will do all that I can to remain the best that I can be. And I will attempt to help others become the best that they can be.
Doctor, get out my head. Yeah, I tell you, this is how the industry stole my lyrics on songs. Everybody, if y'all don't know, the Doc and I, we used to spin together. That's my girl. Rock out.
I want to publicly thank you. I feel like every time I see you, I just want to hug you so tight and tell you thank you. Since we've known you, we've each had different health challenges, and you've been right there. You've been there every step of the way, and we truly appreciate you for that.
My pleasure. You guys are beautiful people. I think you're doing a wonderful job. I like this living room conversation because it is an avenue that you can reach a lot of people. And you'll see as we go along that we have all these healthcare disparities and we leading the way, but it's because information is not getting into our communities. And so whatever avenue we can do, Real Talk Chronicles is doing it. So it's for me.
Absolutely. With that being said, and all that I've said, everybody share it, subscribe to it. Please pass the information on. Don't be selfish with this. Don't have the doctor to yourself. Share the information. Come back. Listen. Right? Come back, right?
Yes.
This is the fourth Monday of the month. Like I said, we got some stuff. The doctor will bring the family in there. We're going to have a house full of Macks.
I can't wait.
We're going to rock. I really look forward to that. Listen, let me tell you something. Wednesdays, Mondays, we'll add days. I don't care as long as we can get the family in here to share their knowledge. And then, like I said, we're gonna next month. You want to talk about? I know you mentioned what you want to talk about, and then after we talk about that, we'll open up for some formal questions and stuff like that. But everybody, that is Dr. Theresa Mack, that is Malika Forster, and I am Bill Forster. You have fostered the moment. Real Talk Chronicles, baby. You don't get no better.
Sending some love your way.
Exactly, Doc.
Okay. Thank you.
Thank you.
Good night, everybody.
Thanks, everyone.
See you Wednesday.
Bye.
Okay. Bye-bye.
Bye.